start for real. I'll mention that. So hi, everyone who's coming in now. Welcome to the May edition of the Cornell Equine Seminar Series. So if you do have any questions throughout, if it's something that, you know, maybe you're confused about or we should really address before we move on to the next topic, feel free to pop those in the Q&A. And if it's of that category, I'll certainly stop Dr. Pinn and ask her to address it. Otherwise, we'll probably mostly get to questions at the end. Usually we reserve a few minutes at the end just for that. And we're happy to also kind of address anything you know, with specific cases or whatever. The clinicians are happy to often talk about those and, you know, if needed, make an appointment even. So those will probably get mostly to the questions at the end, is the short version of that, but feel free to use the Q&A at any point throughout the talk. And then we'll also be recording the session, which thank you, Sarah, she started that. And so we will be posting it later on the YouTube playlist for the Equine Seminar Series, which is on the same website that you presumably used to register for this talk. So we'll be sharing that later, probably within a few days usually. And then they're up there indefinitely, so you can learn forever. And I think I'll probably just quickly introduce myself, and then Dr. Perkins will be introducing Dr. Pinn, who I should say, so I'm a veterinarian. When I was in veterinary school, Dr. Pinn was a resident, and we definitely took care of some foals together. And it's possible that we were all, she was working under Dr. Perkins at the time. So it's possible that we all shared a foal case at one time or another. But so I also work at Cornell now. So I'm a Cornell's Equine Extension Specialist, and I also am a lecturer. So thank you very much, everyone, for joining us. And I'll let Dr. Perkins introduce herself and Dr. Pinn, the speaker.
So hi, everybody. I'm Jillian Perkins. I'm the Associate Hospital Director of the Equine and Nemo Farm Animal Hospital. So I really appreciate Sarah and Lindsay for organizing the seminar series. That's been going really well. And I also just want to thank Dr. Toby Pinn for speaking here today. As I've worked with Toby for a while. She was an excellent large animal medicine resident and has moved on and done great things, and is boarded in internal medicine and has worked in private practice, both in Vermont as well as locally at Eastview Veterinary Clinic. And then we're lucky enough that she came back to Cornell to work in our Animal Health Diagnostic Center and also in our hospital. So she kind of wears many hats here and answers many phone calls from veterinarians and clients about, you know, various health issues on the farm, and helps align the diagnostic test with what is going on in a particular scenario, and then helps us in our hospital too. So, so thanks a lot for being here tonight, Toby, and we really look forward to your presentation. I also should say we wanted to kind of introduce people and say how horses are in someone's life at this point. And I know Toby has a small farm with how many horses, Toby?
Currently 4.
Currently 4, and a few children. Are you able to get out and ride them, or maybe the kids are sitting on them?
A little bit of both these days, so we're all taking turns.
Oh, excellent. All right, so that sounds great. Yeah. All right, well, we look forward to hearing your talk, Toby. Thanks a lot.
Thank you for that introduction. I will go ahead and share my screen. And hopefully you are all looking at the first slide of the presentation. Perfect. Okay. All right. Well, thank you for joining us this evening. I am going to be talking about a broad topic, equine wellness. And, you know, the general theme is that age-old saying, an ounce of prevention is worth a pound of cure. So I'm going to be presenting on things that we can do to prevent our horses from, hopefully, from getting sick and having any health emergencies. So this topic, equine wellness, it encompasses a few different areas. And the areas I'll talk about this evening are going to be preventative medicine and the routine veterinary care that your horses will need, nutrition a little bit, and then a bit about infectious disease control and how to prevent your horses from getting and coming down with any infectious diseases as much as you can do so. And of course, animal husbandry is a component of equine wellness, a very important component. And that really encompasses, how your horse is stabled and how you care for your horse generally on a day-to-day business basis. But that I won't cover as much as evening. So we'll start off by talking about preventative medicine. And the first part of preventative medicine is your annual wellness visit with your veterinarian. Most of us have our vet out once a year, sometimes more, but usually at least once a year, oftentimes in the spring. And during that visit, we expect our veterinarian will perform a thorough physical exam, discuss and administer vaccinations, discuss dental care, assess whether the horse requires any. Sheath cleaning is usually offered if needed in gelding. The owner has the opportunity to bring up any concerns that they've had over the last year or sooner. And then an overview of how are you managing parasite control for your horses, usually is taking place during this visit. So we'll start off by talking about the physical exam. There's a lot of things that your veterinarian is assessing during this exam, and I can't possibly cover them all. But the main things that the vet is keeping an eye out for would include assessing the heart and lungs using a stethoscope. The vet will take what we call the vital parameters, so the heart rate, respiratory rate, temperature, and they're going to be assessing for things that they can hear with their stethoscope, but you may not have been able to observe just in your routine interaction with your horse, such as cardiac arrhythmias or maybe abnormal lung sounds, perhaps. They'll also take a good look at your horse's body condition. They'll do an oral exam, probably. Take a look at the hooves, look at for the hoof health. Look for any problems that are new. Maybe you've noticed something come up and you point it out to the vet, or maybe they come across a new problem they don't remember from their previous visit and they point it out to you, such as a skin abnormality or mass, maybe something going on in the eyes, or perhaps the development of clinical signs that might suggest a metabolic disease. And then it's also an opportunity for your veterinarian to recheck chronic conditions. So something that's been previously diagnosed and that perhaps you're managing on your own for the most part, but you can check in. Equine asthma would be an example. As I mentioned, metabolic disease, such as equine metabolic syndrome, Cushing's, arthritis, or kind of chronic lameness that you're managing. So we'll kind of go into each of those factors in a little more detail now. So I mentioned the vet will want to assess your horse's body condition. So they're taking a look at areas where there should be muscling, areas where a horse has an excessive fat deposit developing that might be a symptom of a metabolic disease. And these are the areas where the vet is kind of looking for these fat deposits in your horse. And then they're going to correlate that with a body condition score. So obviously you can't really read the fine print on this slide, but the purpose is for you to understand that we have this scoring system. Usually it's 1 to 9, where a 5 is an ideal body weight, 2 would be very thin, and a 9 would be obese.
Excuse me, Dr. Pinn.
Sure.
Sorry to interrupt. I'm wondering if we could switch back to the first microphone. We're getting some feedback on this one now. I know we tested them.
Okay.
Sorry to interrupt.
No problem. Is this any better?
Currently, yes, that sounds better.
Okay.
Thank you.
Let me know if it happens again.
I will. Thank you.
Okay. So I was mentioning body condition in case you couldn't hear me, and we use a scoring system. This chart shows the scores which is 1 to 9, where 9 is obese, and the lower end scores are horses that are underweight. So some examples would be the horse on the left, you can see is thin, you can see his ribs, you can see his withers are very prominent, his hips are prominent. The horse in the middle looks nicely muscled and nicely conditioned, doesn't have any excessive fat deposits. And the horse on the right is clearly chubby. And so we would give these horses a score of a 2, the thin horse, a 5, this ideal body condition horse, and a 9, this obese horse. So your vet might, assess and note a body condition score. And then, should that score be far outside what we want for ideal, they might want to address nutrition or other things with you to bring that horse's body condition closer to that ideal number 5. So I mentioned that they'll take a closer look at your horse's eyes during the physical exam. It is difficult to assess abnormalities in the horse's eye in bright light, such as like the barn aisle or out in the pasture. And so sometimes owners don't notice when abnormalities are starting to develop. So oftentimes it's really nice during that annual visit when you can move the horse into a stall or a darker area and assess the eye a little bit better using a light. And so normally in the eye, I just wanted to point out a few things that the vet might pick up on. So normally the horse has this little body in the eye called the corpora nigra. It's this dark structure that sits kind of over the pupil. That is normal, but it can develop some abnormalities such as melanoma, as in the picture on the right, or what we call a corpora nigra cyst. Anyway, these are things that the vet might notice amongst others in the horse's eye. I mentioned they'll look at the hooves. 3 conditions of the hoof that your vet may detect and want to discuss with you during the physical exam might be laminitis, and the picture on the left. I can see some abnormal growth rings there that would suggest, even if this horse is not experiencing any pain currently, maybe that there have been some laminitic episodes and they might want to discuss that with you. White line disease or even thrush. So they might want to chat about that. Another aspect of the wellness exam is the Coggins test. And I think a lot of us know that that's a test that's often required for us to travel, to go to competitions with our horses where they might congregate, or to, for selling a horse at a sale, it's required. For getting a horse ready for sale, the vet might need to pull a Coggins. And it's important to understand that this test not only is required for regulatory purposes to attend these events or travel, but it's also part of a bigger plan to control a disease in our country. So this test is looking for equine infectious anemia. And this disease causes fever, weight loss, anemia, and can cause death. And there was a time years ago where this disease was far more prevalent than it is now, and a control program was put in place. So running this Coggins test on your horse before it has the opportunity to commingle with other horses not only allows you to go to those events, but it also helps protect other populations of horses and keep your horse safe at the same time. And you probably are familiar with the paperwork that goes along with this test. Sometimes it's handwritten, hand-drawn carbon copy paper, and other times it's submitted electronically through Global Vet Link is a very common program. Sometimes the vet during the wellness exam will recommend some screening blood work, and there are different reasons why that blood work might be suggested. Maybe you have a geriatric horse and it's about time to sort of assess some liver and kidney function and just check in and make sure everything's working great. Maybe you live in an area that is selenium deficient, such as New England, or your horse is not getting a lot of grass, and maybe the horse has some clinical signs suggestive of some of these deficiencies, and your vet might want to test for them. And I'm going to talk a little bit more about vitamin D and selenium during the nutrition portion of the talk. Other reasons to do blood work during your wellness is to check in on diseases that maybe have been previously diagnosed, such as some of the more chronic endocrine conditions like equine Cushing's disease or equine metabolic syndrome. So by monitoring those diseases during your annual wellness exam, you have the opportunity to keep those diseases in check and prevent kind of a health crisis, such as a laminitic episode secondary to either of those diseases. Next, your vet will want to discuss vaccination. So I thought it'd be good to just chat about how these vaccines work. So when we vaccinate a horse, we are introducing an antigen or a foreign substance into the horse's body, something that maybe they've never seen before, and we're introducing it in a safe way, such that when the horse's immune system sees that foreign substance or antigen, they can create antibodies to protect themselves against it. And that way, in the future, if that horse becomes exposed to that disease, their immune system has some memory, and it can build these antibodies quickly and fight off that disease, or at least experience a less severe infection potentially. So we can start vaccinating our horses as foals, usually between 4 and 6 months of age. We will introduce vaccination. It's important to remember that when you first start a vaccine program, most vaccines require a booster in order to build protective immunity. So not just one dose, but typically at least 2. And for most diseases, once you've gotten beyond that initial series, an annual booster will suffice to keep their antibody levels in a protective range for most horses. There will be certain diseases and certain risks with horses that have a higher risk of exposure of certain diseases, and your veterinarian can help you assess that. They may recommend a booster twice annually, just to really make sure that the horse is protected. And an example of that might be the flu rhino vaccine against equine influenza and equine herpes virus. Those vaccines are sometimes given more frequently in horses that live in big show barns or traveling a lot to competitions and have a lot of risk of exposure. The normal route that we give these vaccines is in the muscle, intramuscular, or intranasal, squirted up the nose. So let's talk about what are we usually vaccinating against. The diseases that we tend to call our core vaccine diseases include equine herpes virus 1 and 4 and equine influenza virus. Those are both respiratory viruses. Eastern equine encephalitis virus and West Nile virus. Those are mosquito-borne diseases that cause neurologic disease in horses. Tetanus, which is in the horse's environment, and they can be at risk if they develop an open wound. And then, of course, rabies, should they come in contact with a rabid animal. Oftentimes it's a skunk, can be other mammals, and are bitten. They would hopefully be protected if they've been vaccinated. There are a few other diseases that are considered non-core, but depending on where you live and what you do with your horse, you may consider them core for your horse. So those might include Potomac horse fever, botulism perhaps, strangles, and Lyme disease. So I mentioned that we give our vaccines intramuscularly, most of them. And I just wanted to show the correct location for intramuscular vaccine in the neck. Sometimes your vet might choose to give a vaccine in like the pectoral muscle or another site because maybe the horse tends to just do better with vaccines in that location. They get less sore. But for the most part, I would say veterinarians are vaccinating in the neck. And it's not just anywhere in the neck. We kind of have some boundaries that create a triangle, and we go in the center of that triangle. So those boundaries are the green line below is the sort of cervical spine. We don't want to inject right over the cervical spine. The red line above is the bottom of the horse's nuchal ligament. We don't want to inject there. And then the blue line shows sort of the boundary of the scapula. We don't want to go where the scapula is and where the bone is. So we go right in the middle. That's why the vet gives the vaccine in that location. And then, as I mentioned, some vaccines are intranasal, and they have these little applicators that allow the vet to squirt the vaccine right up the horse's long nostril and nasal passage to get it where it needs to be. I mentioned that most veterinarians will recommend an oral exam during the horse's annual wellness visit, and this will sometimes require sedation. And the reason that this might require sedation is we like to use a device called a oral speculum to allow us to open the horse's mouth and get a really good look at what's going on with their teeth. Horses tolerate the speculum beautifully with sedation. Most horses do. It looks like a big device, but it's designed to be as comfortable as possible for the horse. And once you have it open and you have a good light source, you can, as you can see in this photo on the right, get a really nice look at what's going on in there. The vet will assess whether the horse has any sharp enamel points or hooks or other abnormalities that need to be addressed. And the most common thing that's done is called the float, or the filing of those sharp points. We use power floats, which are motorized. Again, they make a noise, but the horses tolerate it well. It's very efficient, and sometimes even a more gentle way to file those points over a hand float, which you can see hand floats in the picture on the right. Sometimes you just need those to get back to some hard to reach places with power float, or it's just preference. And the goal, as I mentioned, of the dental float is to maintain or improve the horse's ability to chew and to identify and address any abnormalities. So you might wonder why. Like, why do we have to float our horses' teeth when those horses that kind of live wild, they don't need their teeth floated and they tend to live well? Well, for the most part, those horses that live out in the wild do okay. They probably develop some issues, but the reason that we end up floating our horses' teeth in these stabled environments is horses have hypsodont teeth, which are these long teeth that erupt throughout the horse's life. And you can see in the upper right photo, those long teeth, and a lot of the tooth is buried below the gum line, and it slowly comes down over the horse's life as the surface is ground down. And horses chew in a circular motion. So they create these sharp points on the edges of their teeth. Horses in the wild tend to forage on coarser feeds, and they might wear these points more quickly and don't develop them. And we also offer our stabled horses some softer feeds that don't lead to the same level of wear, resulting in these points. And you can see in that bottom photo, once a horse gets into its geriatric years, and getting into the 20s, mid-20s, there's not a lot of tooth left to erupt. And what you're left with is a very short molar cheek tooth there. You can see that would be the tooth of a very old horse compared to the skull above. Those teeth are from a younger horse. So just wanted to show you some of the abnormalities that we commonly see. In the photo on the left, you can see some sharp enamel points. And in the photo on the right, you can see that those points have been smoothed, but also there's a circle around an area of erosion in the gum where those points were kind of wearing and likely causing some discomfort. Here's a photo of a horse that has a malocclusion or misalignment of its arcades, resulting in uneven wear of those molar teeth. And when that happens, the molar teeth that are kind of up front tend to get these big hooks, and the same happens, or we call it a ramp, when it occurs in the back. And it sometimes can be very difficult to see these abnormalities without an oral speculum, and some sedation, especially in a horse that just doesn't love having its mouth opened. But you could see how these could be causing a lot of discomfort or poor performance or difficulty chewing. Here's one last abnormality I wanted to show. This is a step or an overgrown cheek tooth. And that may occur because the tooth below it is malaligned or missing, allowing the tooth above to overgrow. And you can see that there's a pretty decent ulcer that would align with that tooth when the horse's mouth is closed. So would want to address that to make this horse more comfortable. And that would be very difficult to see without the speculum. So the next thing that your veterinarian will likely want to address during the wellness visit, if you have a gelding, is they may offer to clean his sheath, especially if the horse has been sedated for an oral exam or dental float. And the reason that we clean the sheath is because horses will develop what we call beans. These concretions made up of like skin cells, dirt, and debris that collect in this little cavity at the end of the horse's penis called the urethral fossa. And some horses are really good at making beans and some horses don't make them at all. But the reason we offer to check and clean that area once a year is because you really can't know until you check, first of all. A lot of horses don't tolerate it without sedation. And you try to prevent the buildup from becoming so big that it's compressing the urethra where the horse is urinating out of. And should that occur, the horse might start to strain to urinate and act colicky, and that is an emergency. So we don't want to let that happen. So we can just clean him once a year during the annual visit and take care of that. The next aspect of our preventative care, as I mentioned, is parasite control. And it's nice to have your veterinarian involved in this. Horses are susceptible to internal parasites, which live in the GI tract. And heavily parasitized horses can appear healthy. They don't always look unthrifty or skinny or have a bad hair coat. They can look fine, but still have high fecal egg counts and be contaminating the pasture that they live in for the other horses there. So I'll just talk briefly about the most common internal parasites. This could be a talk all on its own. I just wanted to touch on this today. So we have our nematodes, and we talk a lot about strongyles. We have large strongyles and we have small strongyles, or otherwise known as diaphostomes. We talk about ascarids or roundworms and foals, particularly pinworms, bots, and another category of cestodes, which encompasses the tapeworm. And the photo on the right shows how easily a horse ingests larvae of parasites just in the dew on the grass. So that's kind of amazing. We'll just talk quickly about the life cycle of one of the more common parasites that we deal with, the strongyle. So the horse passes these eggs in their manure, and the eggs develop into larvae in the environment, and then they're ingested by another horse or the same horse to reinfect themselves. So this is why, we really want to keep the environment clean so that they have less exposure. So small strongyles or diaphostomes are one of the parasites that we worry about causing disease in our horses that we want to try to prevent. This parasite tends to burrow or encyst in the intestinal wall. And you can see that photo on the upper right is the encysted diaphostome in the horse's bowel. And it looks irritated and red because it is, and all those little dark dots are little larvae burrowed into the mucosa or surface of the intestine. And at times when horses become extremely heavily parasitized, those can emerge kind of all at one time, and it results in a lot of inflammation of the intestinal wall, diarrhea, weight loss, and colic. So we want to make sure that we're deworming to prevent our horses from diaphostomes. Strongylus vulgaris is a strongyle type parasite that was a major problem years ago, and we see it less now. However, occasionally we do see it, and it causes something called verminous arteritis, which sounds terrible because it is. These parasites will migrate to and obstruct vessels that supply the horse's GI tract with blood supply. And when that happens, it results in colic and infection of the abdominal cavity called peritonitis. And that photo in the middle there is a cross section of a vessel that has the Strongylus vulgaris within it, obstructing it. In foals, we worry particularly about two parasites. Strongyloides westeri, which is passed to the foal in the dam's milk. And so it's very important to deworm the dam upon foaling to prevent the foal from becoming infected. Foals that are infected with this parasite will develop diarrhea, weight loss, and can look unthrifty. And then ascarids or roundworms are another big concern in foals. Horses they tend to develop some immunity to ascarids as they get older, but foals are particularly susceptible. And this is why we need to start our deworming programs around a month of age in foals, particularly to prevent a big buildup of ascarids. When a foal develops a large burden of these ascarids and then is dewormed, a rapid mass die-off can result in a spaghetti-like conglomeration of dead worms in the intestinal tract, creating an obstruction and colic. And it doesn't always have a great prognosis, even with surgery. So we really want to try to prevent this in our foals. In all of our horses, we worry about tapeworms. Their life cycle occurs actually in mites on the pasture, and they cause obstruction where the small intestine enters the part of the horse's GI tract called the cecum. And that upper picture, you can see those little white kind of rectangular structures. Those are what we call the segments of the tapeworm or the proglottids. Tapeworms require a particular type of dewormer, praziquantel or double dose pyrantel, which is not always it's not in every dewormer, and you really need to read the label and make sure that you're choosing a dewormer that contains praziquantel, or you choose double dose pyrantel to treat tapeworms. We see colic associated with tapeworm infections. Botfly larvae is something that I think we've all seen on our horses' legs before, but I just wanted to show a picture of that so you can see the botfly and then the larvae there. And then pinworms are kind of gross, Oxyurus equi. They lay their eggs on the skin around the horse's anus. And when sometimes you see horses with really rubbed tails, that may be from pinworm infection. And here's some kind of gross pictures. So here's that rubbed tail, and there's the pinworm in the horse's anus. So we want to take a preventative approach. We don't want our horses to be heavily parasitized. So we can do so by monitoring individual horse fecal egg counts, or FECs. And we want to keep in mind that a negative fecal does not mean that the horse has zero parasites necessarily. It may not have any parasites, or it may just be, again, a snapshot in time. Fecals are pretty reliable when horses are heavily parasitized, that we see eggs in the fecal for most parasites, but not all. But it's really the best tool that we have to try to gauge the parasite burden and try to guide deworming frequency and what product to choose. Oftentimes you get a result back with a Strongyle egg count. That's categorized into low shedder, moderate, or high shedder, and the vet might decide a low shedder shouldn't be dewormed, but a moderate to heavy shedder may require deworming, just depending on the number of horses in the pasture and how the environment is managed. So deworming protocols are then designed based on the type of eggs we see and the number of eggs per gram in the fecal egg count. Here's an example of some fecal egg counts from a group of horses. And you can see these horses all live together. 2 of them have no eggs in their fecal. We have 1 horse with 1,000, which is a high count. We have 1 horse, Holly, with a low count. So even though they all live together, there's only 1 horse here that's really heavily parasitized. So the question is, do we need to deworm all these horses and be very concerned about all these horses, or can we target one? Well, we definitely want to deworm Emma, but maybe we don't want to just ignore the other 3. So I'm going to talk about that in the next couple of slides. So we want to try to prevent the development of resistance to the drugs in our dewormers, and those are called anthelminthics. We'd like to avoid having a resistant population of worms on our premise so that our horses don't get heavily parasitized and sick. So we do that through a theory called refugia, which is that the definition of refugia is the portion of a parasite population that is susceptible to still being killed by a dewormer. So the portion of the population that's not resistant. We want to maintain a population of not resistant parasites in the environment, because we want, if our horses are going to become infected with parasites, we want to make sure that we can treat them effectively for them. So we're trying to kind of dilute the resistant parasite population with these drug-sensitive parasites. So as I mentioned, when I showed you that slide with 4 horses and only one of them with a really high worm burden, do we just deworm that horse or should we treat everyone? And this is something that the veterinarian can help you decide, but it's important. Some horses just may need to be dewormed more frequently. They are more susceptible to parasitism. That is an individual susceptibility. We particularly see geriatric horses developing higher worm burdens, and they may need to be monitored and dewormed more frequently. In general, all horses require at least once annual deworming with a praziquantel containing product to address particularly tapeworms with the praziquantel. As I mentioned, you can also use double dose pyrantel for that, for those tapes, but we want to make sure that we treat horses for tapes once a year, regardless of their fecal egg counts. Because those tapeworm eggs are not reliably shed on fecal floats, we kind of have to always assume that they're there and treat our horses for them. We also want to prevent the buildup of diaphostomes and Strongylus vulgaris as well. And so for those, we have dewormers other than praziquantel that are usually provided in combination. So you're probably thinking of things like you see ivermectin on the label, bendazole sometimes, but we only, in the United States, praziquantel is only sold in combination with either ivermectin or moxidectin, and there are some brand names out there, but really let your vet help you choose the product. It's really better to make sure that you're covering all the parasites that you need to. So we use those fecal egg counts to identify the higher shedders that are responsible for contaminating the environment and deworm them as needed. And there's some really great guidelines, and this link can be provided to you in a follow-up email, so don't worry about copying it down now. When we do have resistance developing, or we have a concern for resistance to dewormers developing on a particular farm, we can use a test to help us assess what drugs the resistance is developing against and what drugs will be more effective on that property. And the test we use for that is called the fecal egg reduction test. So we take a sample of the horse's manure and get a fecal egg count prior to deworming. And then we deworm that horse. And then 2 weeks later, we collect another manure sample and we compare the egg loads in both samples. And we'd like to see a reduction of close to 100% to tell us that the dewormer is still effective in the population of parasites on that farm, particularly Strongyle type parasites. So just to summarize parasite control, I mentioned that all horses should require annual deworming, possibly spring and fall, depending on the premise. Brood mares particularly need to be dewormed upon foaling. Foals require deworming starting at about 1 month of age, particularly to control ascarid infection. And our geriatric horses may be more susceptible to parasitism, especially those with Cushing's disease, and they may need to be dewormed more frequently. So nutrition I'll touch on here just briefly, because again, this could be another topic all on its own, but we'll just go over some basics. So we want to obviously provide good quality hay, and we can assess the quality of our hay through hay analysis and looking at the components such as energy, protein, fiber, starch, and vitamins and minerals. And this tool I just wanted to show is called a hay core, and it's a great way for the veterinarian to collect a representative hay sample from all your bales of hay to submit for this hay testing. We want to make sure that horses are getting some sort of vitamin mineral supplementation and follow the label instructions always, But one nice way to do this is through the use of ration balancers. Some horses are on a great quality hay and they're at a good weight. They don't need extra calories from grain, but they do need those vitamins and minerals. So we can provide them with what's called a ration balancer, which is usually a low starch, low calorie, vitamin mineral pelleted supplement. Those free choice mineral blocks are not always adequate to provide essential vitamins and minerals, especially selenium. And not all mineral blocks even contain selenium. So it's really important to check the label. If you live in a selenium deficient area and you're putting it out for that reason, you want to make sure that there's selenium in it. But even providing that block, because we're depending on our horses to go to it and consume it, free choice, some horses don't like it and they won't consume enough of it. So I mentioned that selenium is something we're really concerned about, particularly in New England, because we have deficient soil. And so we want to avoid selenium deficiency because it results in muscle loss, poor performance, and weakness. And in our neonates, our young horses or foals, it can cause a disease called white muscle disease, which can be life-threatening. We are concerned about making sure horses are getting enough vitamin E, and we want to do so because vitamin E deficiency is associated also with poor performance, muscle weakness, muscle wasting, and can be associated with neurologic diseases as well. Lush green grass is the best source of natural vitamin E, but not all of our horses have adequate access to that, especially in New England where we have a long winter and a short grass growing season. So we might need to supplement that. And we want to supplement with a natural source of vitamin E for best absorption. And not all horses need grain. Horses that might need grain would include, not all encompassing, but particularly we worry about horses that are in a high level of work that need the extra calories, horses that are seniors that don't have great teeth anymore and they need some sort of complete feed senior grain to provide those extra calories because they can't chew their forage. And then we might provide certain low starch grains for horses with metabolic diseases. So not all horses need grain. Those that do, we want to make sure we choose a grain that's appropriate for that horse's health concerns and level of performance. So finally, the last part of this equine wellness is infectious disease control. So we can do all these things to make sure our horses are in good body condition and to try to vaccinate and prevent infectious disease. But there are a few other things that we should talk about to make sure that you can really optimize your prevention. Infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, parasites, and a contagious infectious disease is one that is spread from one horse to another by direct or indirect contact. We all know that it's very difficult to avoid germ sharing. Those children in the daycare sharing toys, that's really the equivalent to our horses out on pasture that are sharing mineral blocks and touching each other over the fence. And healthy looking horses can be shedding bacteria and viruses that are contagious to others. So those are what we call asymptomatic shedders. And when you go to an event, a show, when you congregate with a group of horses, they all might be apparently healthy, but sometimes those horses are inapparently shedding disease, and it's easy to come in contact with them just by being around them. So what do we do about this? These things that we cannot see, how do we prevent them? We can't wrap our horses in bubble wrap, unfortunately, but we do have some tools for prevention. So I mentioned that these diseases are contagious. And so how do horses, first we have to understand how our horses might contract them. So one way is called fecal oral transfer. And that's when one horse consumes organisms that are in the manure of another horse. We have aerosol droplets. So a horse sneezes and a virus or bacteria gets into the air and another horse is nearby and is able to inhale it. Nose to nose contact, so through touch. And then fomites. And what are fomites? Fomites are objects that can be contaminated with an organism And when another horse comes in contact with that object, they become exposed. So our hands are fomites. The tools we use to clean our horses' stalls are fomites. The trailer can be a fomite, or a shared water trough is a fomite. Those are just a few examples. And so now we have to think about biosecurity. And we shouldn't get worried about biosecurity. We should just think about it as procedures intended to protect humans and our animals against disease. So how do we prevent the spread of infectious disease? By practicing good biosecurity. I'm going to go through that, and I really like this cartoon. If this woman were to go down the line and touch all these horses with her carrot and share it amongst all of them, and if she had started with the sick horse and ended with the healthy horse, that's one way that she could act as a fomite and carry disease from the sick horse to the healthy horse. So that's just an example. We want to try not to do that. So tools for prevention and for use in our biosecurity practices. We already talked about vaccination at length. It's important to use vaccination to establish herd immunity, to try to minimize our horses' exposure to these diseases. We want to implement good practices when we bring new horses onto our farm. So those apparently healthy new horses can be carrying disease, especially if they've come from larger sales or auctions where they've been around a lot of other horses. When they get to our farm, the best thing to do is to try to isolate them from our other healthy horses, usually for, if possible, a month, at minimum 2 weeks, but some diseases can take longer to present. So we want to isolate for 30 days whenever possible. And we can do so by setting up sort of a quarantine area on our farm, which doesn't have to be fancy. You know, if it's just a fenced in area where there's no nose-to-nose contact, that's a little bit separate from the other horses. If that's the best that can be done, then that's what you should do. And do the best you can to prevent the nose-to-nose contact, to manage manure, and to also keep yourself clean as you move between the healthy and the sick or potentially sick horses on the farm. So as I mentioned, separate paddock, avoid nose-to-nose contact, feed and clean the new horse after handling all your resident healthy horses. You can cover your clothes when you're working with that new horse in case he's shedding something to sort of keep you clean. You can wear coveralls or something like that. You can wear different boots or change your boots or use foot baths to keep your footwear clean when you're going between the healthy horses and the sick or potentially sick horse. And of course, you can use gloves and hand sanitizer and wash your hands. So here's an example of an easy way to make a foot bath. Just using bleach solution that you have around in a 10-to-1 ratio is effective against most pathogens, not necessarily all, but it's something that most people keep around their homes or their barns and that you have readily available. And you do need to remember that as these baths become contaminated with organic debris like shavings or dirt, you need to change them to keep them effective. Managing the people that come and go from your farm and how they interact with your horses can also help prevent infectious disease in your premise. So you can ask the people visiting the farm to arrive in clean clothes, use clean shoes, or change before they come or upon arriving. Those of us who are at boarding facilities or work with trainers that come to our own personal home, those equine professionals have been at other facilities throughout their day. And so, having a conversation with them just about, kind of how you want to manage biosecurity on your farm, making sure that shoes are clean, hands are washed, if they've been around a potentially sick horse, that they should, cancel their visit or make sure that they change before they come to your property. So as I mentioned, having that discussion and also providing those equine professionals with the tools they need to practice good biosecurity. So making sure that there's like a nice bucket of clean water for them to clean if it's floating equipment, if it's the vet and it's their floating equipment, that's always really handy. Just make it easy to practice good biosecurity. And so what can you do when you're traveling with your horse to prevent them from infectious disease? So take your own equipment as much as you possibly can, your own buckets, cleaning tools, grooming supplies, obviously tack. So try not to share those things with people, that you don't know the health of their horses or where they've been. Avoid those communal areas like water troughs, tie rails, if possible. Try to avoid that nose-to-nose contact between your horse and others. And minimize your horse's contact with manure from other horses, either directly by like sniffing piles on the ground or through using like shared cleaning tools. And it's important to remember that, when a horse does present to you as acting sick, they can just be, off feed, look dull, and the cause of that could be any number of things. And so another aspect of preventing infectious disease in your horse is to notice clinical signs as fast as you can, being vigilant, but then calling the veterinarian in to assess. And it's sometimes, the clinical signs are non-specific. We can't say for sure what the problem is. So the best thing we can do is know our enemy, know what is making our horse sick. And so the vet might recommend some diagnostic testing to try to get to the bottom of what's the problem so they know how to best address it. And so, this building that I'm standing in right now is the Cornell Animal Health Diagnostic Center. And this is a place where we perform a lot of those diagnostics to try to help people establish what infectious disease they're dealing with so they know how to treat them. It's not always black and white, as I mentioned. And there are a lot of aspects that come into play when we're trying to diagnose, prevent infectious disease, diagnose it, and manage it. So you have to have some patience, but hopefully with some time and some patience, you can get to the bottom of it and prevent it. There are some great tools that you can use as a horse owner to keep track of infectious disease in the United States, as well as in Canada. And there's this fabulous site called the Equine Disease Communication Center. And you can go to this site, you can read about good biosecurity practices. You can also read about what diseases are happening in your state. And there's a nice map that you can go to. There's a nice search. So if you're just trying to stay kind of on the forefront of infectious disease, if you travel a lot with your horse to different states and you want to know like what's going on there right now, you can go to this site and you can try to get a better idea of, what disease events might be happening in your state or around you. So that concludes my whirlwind of equine wellness, and I'd be happy to take any questions.
Thank you very much, Dr. Pinn. That was great. There have been a bunch of questions submitted, and I'll actually probably start with one that I feel like we need to take advantage of having an internist here. So I'll just ask this question first. There's someone saying that she did some annual blood work on her 30-year-old gelding, so that's always good to hear. And that there was an interesting finding of slightly low protein, and she's kind of wondering, I think, does that mean I need to feed more protein, or what could that mean?
Oh, okay, good question. So oftentimes when we see low protein on our blood work, it doesn't necessarily mean that there's deficiency in the diet. It actually suggests that that horse is leaking protein for some reason. And the two main ways that a horse could leak protein from its body are through the GI tract, like loss through the GI tract, or through the kidney. If the kidney values are okay, then we often turn to the GI tract. And things that are common that can cause low protein in our geriatric horses might be things like sometimes ulcers or other, GI diseases. So that might take a little bit more investigation from your veterinarian, some additional diagnostics like abdominal ultrasound. We can look for blood and protein in the horse's manure that can help us understand that the loss is through the GI tract as well. We can use endoscopy to look for ulcers in the horse's stomach, but unfortunately we can't see the intestine, much of the intestine with endoscopy. So definitely could suggest that there's some underlying inflammation in the horse's GI tract, if the kidney values are normal, and you might want to talk to your vet more about that.
And as always, if you do run into a wall, your vet can always consult with the internist here at Cornell. Maybe even find out. And then there's also an early question we got. Someone's wondering if you have any thoughts or advice on handling summer sores in horses, kind of a seasonal issue that's coming up.
Sure. That can be such a frustrating problem. And everything that you can do to minimize their exposure to the little colicoides gnats that the horses tend to become allergic to, or other insects as well. But even with all that body armor, we can use fly sheets, we can use our fly sprays. Sometimes they still get in there. Some people will use fans to try to keep the bugs away from their horse. So have the horse in a stall during the times of day where those gnats really love to come out, like dusk and dawn, and with a really strong fan to try to keep the bugs off of them. But there are situations where we have to resort to some administering some anti-inflammatories and sometimes steroids to manage that. So again, you need to work with your veterinarian to try to get on a treatment protocol or a preventative protocol. Some people do try antihistamines as well, and they can work variably in different cases, but I understand that can be very frustrating. So yeah, definitely work with your veterinarian if you're already doing all those other great things like fly sheets and fans and lots of application of fly spray.
Yeah, and if anyone's interested, I put the AAP's reference for that for future reference, or you can come back and watch this video. And so there's also a question, you mentioned sheath cleaning. There's an attendee wondering whether this is something that owners can do between vet visits, or is this only safe for veterinarians to do?
Okay, another good question. Some horses, some geldings are really amenable to the sheath cleaning, and it can be safe for their veterinarian to do it without any sedation. As long as your vet has shown you how to do it safely and correctly, so that you don't create inflammation as you're trying to actually help your horse. We need to make sure we're using gentle soaps and gentle cleaning products so that we don't cause a reaction in that kind of delicate part of our horse's body. So yeah, some owners do it. I think that it's important to remember that most horses don't need it done terribly frequently. Once a year is enough for the majority of horses out there. Those horses that tend to really get gross and make big beans, they might need it twice a year. And if you have one of those horses, again, talk about it with your vet to kind of figure out how frequently, because if you over clean the sheath, you can actually cause more harm than good and set them up for a yeast infection. So there's a little bit of a fine line there, but absolutely owners can be trained to do that perform that procedure and do it themselves. Just don't get kicked.
Yeah, safety first, guys. So there are a couple of interesting questions kind of related, almost regarding differences between vaccinating horses and kind of small animals. So one is, can you not, or why don't you use or perform subcutaneous injections in horses? And then another related one is, it seems that dogs only need rabies vaccines every 3 years. Why are horses every year?
Okay, I guess I'll address the first question about subcutaneous versus intramuscular. Horses do tend to be a little bit more reactive when medications are administered subcutaneously, or vaccines in some cases. So the purpose for the intramuscular route in horses may be one, that the horse had a reaction to that vaccine when it was administered subcutaneously. And the second might be that they found that the horse was able to have the most efficacious antibody production when the vaccine was administered in the muscle. So I would say that first reason that horses tend to just be a little bit more reactive to sub-Q injections is probably a major one. And then the efficacy studies performed by the pharmaceutical companies are typically done in the intramuscular route. And that being said, there is one vaccine out there that is not considered core, and we don't have a lot of information on. But some people do vaccinate their horses for Lyme using an off-label canine vaccine. And there have been studies to show that horses have the best antibody response when that is, or a good antibody response, and compared to intramuscular when that vaccine is given intradermally, so in the skin. But that's really the only vaccine that I can think of where that has been shown. So yeah, so I am for our horses in the muscle.
Yes, and then the rabies,
The
1
rabies.
versus 3 years, and can we titer or what? How does that all work? Yeah.
Sure. So a lot of the duration of efficacy of vaccines is based on studies done by the companies that provide them, that manufacture them. And for horses, it's like these studies have shown that, you know, duration of immunity lasts a year. So for certain products, they may not have looked beyond a year, or maybe they have, and they found that antibodies waned, and it was required to perform that annual vaccination. You can draw blood for titers. There is the opportunity to do a rabies titer, and some shows will accept a rabies titer instead of a vaccine. Some, not all. And the reason we have trouble interpreting titers sometimes, because that antibody level is not the only thing that's protecting our horses from getting sick. There are other aspects of the horse's immune system that come into play. And if one of those other aspects of the immune system fails, despite having good antibodies, the horse can still get sick. So again, it's not a black and white issue. There are horses out there that react very badly to vaccines. They have, you know, they're prone to vaccine reactions. And I can understand when those owners would prefer to try to do titers to try to get an idea of whether we really need to vaccinate this horse this year. Can we try to skip a year? And when we do titers for those horses, again, they're not perfect, but we can at least say, oh, this horse, in comparison to hundreds of other horses, has a really strong and robust titer, and like it's, you know, it probably wouldn't get that much better with an additional vaccine versus this horse is at the low end of the titers that we see, and you know, probably is at risk and probably would benefit from vaccination. So again, not black and white, but we can sometimes use titers to help us decide if we want to vaccinate a horse who's prone to reactions.
Okay, and I guess we have probably just time for 1 or 2 more questions. Maybe we can end with someone who wants a little more information about pinworms, so that's exciting. They're wondering, yeah, they're kind of asking, what are we seeing exactly? They're wondering, are the eggs not microscopic? What is it that's making them itchy? Why do they rub their tail? What's the whole story with that?
Yeah. I believe that the story is that the worm itself is actually like living inside the anus, and it kind of comes out to lay its eggs around the anus, and just that activity back there is itchy for the horse, and that's why they rub their tail and their bum.
Yes. So and maybe the person is asking kind of in terms of what can I look for, and
oh, sometimes you can't see anything around the anus with the naked eye. All that you see as the owner is the fact that your horse is really rubbing their tail. It's all, you know, is all frizzy and sometimes, you know, nude on the tail head where they rub the hair off because they've been rubbing excessively, and that's all you see. So when you see that, you should, you know, consider maybe my horse has pinworms, and you should consider, you know, treating them with a dewormer.
Awesome. So I think we promised we'd be over at 7, so I think we'll wrap it up. But you do have questions we weren't able to get to. I tried to lump them into a few categories. please do feel free to email us. And so all of us work at Cornell. We're happy to answer any questions. We'll send out some follow-up information after the talk, both with a bunch of links that Dr. Pinn mentioned in her talk, or maybe that I shared in the chat during the talk. And then also information. So if you want to schedule an appointment with the internal medicine service or get some more information about the diagnostic center, we'll include all of that information in the follow-up. And I believe Sarah might have an announcement or two regarding June's talk, but thank you very much, Dr. Pinn, for sharing everything with us.
Yes, I do. Yes, thank you, Dr. Pinn. My list includes, yes, we'll be sending you a follow-up email with the link to this recording. Feel free to share it, and there will be additional resources, some great information. We're doing kind of a bonus equine seminar series in June. We have Dr. Michelle Delco, an equine and surgery specialist, who's going to be presenting 5 tips for keeping your horse sound. That's going to be on June 15th. So I will be sending you the registration link and everything like that you need. And then we're going to be taking a summer break in July and August, but we will use that time. We've already started trying to plan what our fall seminar series is going to look like. Dr. Pinn recommended a lot of great topics to consider. I'll also send out several topics that take a deeper dive into things like vaccines and parasites that we've already covered, but we have many more topics to cover, and we're excited to introduce you to even some new faculty that are coming to the hospital that might be able to present to you in the fall and spring next year. So we'll be in touch, but feel free to reach out if there's anything that you are dying for us to present on. Please let me know. And with that, I will say thank you to everybody for coming. Thank you again to Dr. Pinn, and have a good night.
Yeah, thanks and good night,
Everyone.
Take care.
Bye, everyone.